It gives me great honor to welcome up to the stage good Wesley Solomon. Wesley? So what to present? You've heard about me now. We've heard a couple of very interesting presentations this morning. And thinking about this, you know, us consultants, we deal in wisdom, right? Who's consultants here? May I just check? Anyone who consultants? Thank you. None of my Deloitte consultants put up their hand. So if any questions afterwards, can you just lift your hand if you work for Deloitte? Besides, here is a brain trust of various experts. Please find them at the stand, ask more questions. But in terms of what I'm going to present to you today is I'm not going to go into technology because you're going to hear a lot about that. And there's a lot of people here that's fundamentally brilliant at it. But I'm thinking about this as, and I'm making this up, Hannes. I'm making this up right now. But if you think about healthcare as the 4 Ps, you've probably heard of public-private partnerships, philanthropists, and things like that. These are my 4 Ps, all right? Healthcare is about fundamentally 2 things. Number 1, oh, by the way, that's our EXCO member over there, Greg. Just raise your hands, Greg. He's here to make sure I don't overstep. But on a serious note, we're very, very, very passionate about innovation, and you'll probably pick it up through the presentations. But the first thing, we have to think about healthcare, and I've worked in healthcare for a very long time. Healthcare is really a rationing system. That's really what it is. Finite resources, needing to give the best to a population. That's really what it is. And there's 2 parts of it. There's the people who are responsible for provision, how are we getting the money to pay for this? And then there's the people that are busy with the providers, and I have a slide on that one. But what I find very interesting this morning is that healthcare's got a second 2 Ps. COVID has taught us that healthcare is public. It's a public good. When populations are sick, productivity goes down. So public is important. What I loved about the presentations is healthcare is also deeply personal. So the 4 Ps are public, private, private, provision, providing, public, and personal. So I'll go straight into this one. What are the principles that are really, really underpinning both this provision section and the people busy with providing? Everyone is striving to become more efficient and applying a lot of innovative techniques. Sometimes it's really simple. Sometimes it's just talking to the person. Sometimes it's like changing the name on a letter. It's not millions and billions of dollars sometimes. It's really small innovations. But both provision side, through medical aid schemes, through the way we treat funds, through even personal expenses, we're trying to become more efficient and that way save money. And the providing side also looks to be more efficient in order to provide better care and increased coverage. You can distill healthcare down to just these tiny concepts. And when you listen to the presentations today, I'd love you to just put in the back of your head, out of which part does this intersect? And guess what? It could be both, or all of it. A well-functioning ecosystem will look at all factors contributing to healthcare. And what are the 3 buckets at the bottom that really influence this? Number 1, technology. It's a game changer. If you apply technology to situations really, really well, and under the right level of risk control, technology can really, really be your friend. Technology can also hamper you. Let's just take in question my very, very large presentation that happened to crash the computer today, causing us a wonderful opportunity to network for a lot longer than we should have. The second thing is information systems. There are many beautiful banners out here, and a lot of people will be presenting on different ways that information is synthesized. Oh, hi, Irene. How are you doing? Sorry, I didn't see you earlier. Information systems that take this information, concatenate it in ways that we can make intelligent-based decisions. If we look at the Netcare app, it doesn't only take the personalized level of it, but takes it down to the supply chain. It takes it down to provisioning of services. Information systems are a powerful tool when information is taken from data to info. Otherwise, we just get a whole bunch of terabytes and gigabytes and Star Trek bytes of information. The next thing is education. That also fundamentally puts in the buy-in from different stakeholders of, do you opt in? And education is I've got kids who are matriculants. There's 2 motivators. There's the carrot and the stick. And sometimes you have to impose fear, i.e., do you know that you're going to die, a 30% chance of dying? Or you have a carrot of saying, would you like to be there for your grandchildren one day? These factors of thinking about when you use technology, converting information systems and get buy-in in education is really how the ecosystem works if you really cut it up in other words. So let's look at information systems in a more traditional sense. My presentation is about climate and health, an intersection of that, because I thought I'll give you something different, like Monty Python, now for something completely different, to get you thinking about where your next layer of innovation is going to lie. We have now already reached a beautiful threshold of really improving healthcare if people buy in. But what's next? What do we need to do to stay ahead of the curve? We know if innovation stagnates when we stand still and become complacent. So I'm just here to give you a couple of case studies and show you how this information can be used to better health systems, and that's what I leave you with today. If you think about normal zoonotic disease areas, and traditionally with climate and health, we have mapping systems, information systems, like GIS. We are hotspots. We are the areas where we can focus our attention, become more efficient, save more lives, improve access to healthcare. And I have a couple of graphs. You've probably seen a lot of graphs like these. You can do many of it, whether it be from the two diseases on the right-hand side. And by the way, the one on the left-hand side with the Africa map, I've purposely not named it. It's very, very low number of cases. If you can guess which disease that is, you can come see me afterwards, and then I'll buy you a free coffee over there. But the important thing I wanted to show you about that map, which is not moving at the moment, is that the El Nino effect moved the burden of disease from West Africa to East Africa in a year. So the burden of disease shifted because of the El Nino effect, and we should have been able to predict that. So any prizes later on for what any infectious disease epidemiologist, you'll be able to pick that up very quickly. But then let's look at the other type of things. Our non-communicable diseases, our NCDs. Do you know that our mountains around, I'm from Cape Town, so we have mountains, but the mountains around us are shifting, they are changing, sometimes even moving, but we can't see it because the movement is so big, and we're just passing by and we're assuming it's always there. That's our problem with our NCD burden right now. It's a huge mountain moving slowly, crippling our economy, crippling our people, and we need to use information systems, intelligence. Our technology is really top-notch. We have really invested a lot in different innovative treatments, etc., for NCDs. But our info systems are not tracking it in a way that's really tracking this mountain moving very, very slowly. Education, some successful, some not successful. But you think about the prevalence rate of diabetes as just an example over here. 12.8%, and this is from the WHO, by the way, 12.8% of our adult population is diabetic. And we are scheduled to increase that through urbanization. Urbanization, wonderful word. What does it mean? Change of lifestyle, change of how we do things, change of diet, change of how we have relationships with people in terms of family members, change of working relationships. These all contribute under the word urbanization. This is a ticking time bomb. This is the mountain that is moving to a point where we're not going to be able to do anything about it. If you look at another one in terms of deaths due to cardiovascular diseases, cancer, diabetes, within 20 years, almost 60% increased number of deaths. 20 years. Who have you been working close to 20 years? Could you imagine having a 60% salary increase? I'd be very happy over 20 years to get there. That's what's the reality of NCDs. Once again, the mountain that is moving that we are not seeing, not tracking, and we are focusing only on the technology. So moving more into the climate side of things. So we're thinking about these outcomes, NCDs, infectious diseases, saving lives, under the banner of technology, information systems, and education. Why Africa? We are a vulnerable continent. If you look at the countries that have got the most number of extreme weather events and natural disasters, and this is a very interesting index because it also says how you can cope with those disasters. 9 out of the 10 worst affected countries are on this continent. If we talk about sea level rise in the Netherlands, and they say 2 meter sea level rise in the Netherlands, do you know what the Dutch do? Okay, we'll just bump it out. They have infrastructure in place to raise and push out the sea level rise, and they can cope with 2 meters very, very easily. A large portion of Rotterdam is already under 2 meters of sea level rise. Take an island nation, Zanzibar, and you tell them 2 meter sea level rise. It's devastating to that country. And that part of the index over here, we look at Africa is incredibly vulnerable to climate change things. In terms of money-wise, We always have to say climate change. Oh, it's important. Yes, we have people doing marches, we wear lovely badges, we do all the fancy things and stuff, but the truth of the matter is it affects our pocket. As an economy, 7% of our GDP every year is eroded. 7% of our GDP as a continent. That is a frightening statistic. To rectify this, 2.6 trillion US dollars of infrastructure change is needed to stop this erosion. This is that mountain that is moving and being eroded that we can't see. If we look at, are we responsible for climate change? Now, there's lots of debate, if it's emissions, if it's other factors, if it's deforestation. We can take one metric. All of us know that one metric used consistently over time is better than 100 metrics that we have refined over 100 years. Compared to the world, Africa only gives 4% of the global carbon emissions, but we are the worst affected. In terms of, this is the interesting thing. I actually wanted to get into this part. Also, the factor that South Africa is very different is we live close to the land. We have farms. And I'm talking Africa, not just South Africa, for a reason, because there are no borders when it comes to climate change and diseases. I know that some people wanted to put some little passports on Ebola, but that didn't work. But there are no borders. There's no passports. We have to think about this as an Africa concern. And in our country, our continent, we are mostly, in terms of our economy, well, a very large portion of our economy is agricultural. Now, this is important in terms of the working population, and I'll show you two case studies. What are we susceptible for? Fortunately, we don't have hurricanes or tornadoes yet, but we do have rainfalls, droughts, flooding. Ask anyone in this room who knows a farmer. Anyone in this room. We can give examples of this recently. But now, because that's a little bit too personal, we're talking about South Africa, and the last time I did something on South Africa, a whole bunch of farmers came after me and said, that's not right, you're not going to tell me to change my crops. So, I'm going to give you two examples in the equatorial region, one from Ghana and one from Kenya. And I'll show you how it ties in from information systems and the ability to provide provision of health services. Population, 34 million, a little bit smaller than South Africa, good GDP, small area. But look at that major unemployment rate there. 3 to 4% of Ghanaians are unemployed. Imagine we had that here. But this is uncovered through the agricultural sector. If you look at 21% of their GDP comes from agriculture. Now this is the double-edged sword. Where do you think that 3 to 4% are employed? They're in the agricultural sector. If we go a bit further onto this, I'm just going to move on to that. It's a very nice slide, I'll let it play, agricultural sector. There's the factors that we have traditional things in terms of the droughts and drinking water. Do you know that Ghana also supplies hydroelectricity to the neighboring states? They're dependent on the economy on water, they're dependent on the economy on agriculture. 3 to 4% of people are unemployed, but they work on the farms. During the times of harvest time, they actually go and move to the farms in terms of a rural drift, like a rural migration. And while they're working on the farms, they're getting money and also improves their food security. What happened to us during COVID-19 when people were no longer in the cities? Globally, we saw pictures of dolphins in canals. We saw the city breathe over there and improve and have their sanitation improved. They were able to do maintenance of things they couldn't get to. That's a global indicator. The same thing happens with the rural migration in Ghana. The number of communicable diseases are controlled. The diseases that are related to sanitation and water purity and water quality have a chance to recoup. This is an important factor of the ecosystem of Ghana for the country's health in terms of the infrastructure. This is a cool slide in terms of the amount of money that's spent on the healthcare sector, but I'll get to this one. If 40% of Ghanaians are employed by the agricultural sector, and the agricultural sector overnight can only yield half of what it usually does. That's half of the Ghanaians that are unemployed. It moves the unemployment rate up to 28% unemployment. Their GDP drops down by 10%, which, by the way, is enough to kill the entire public healthcare sector in terms of their primary healthcare. In terms of flooding, The infrastructure components of the grants that you use to fix the roads after flooding, supply chain, disappears. If climate change happens in Ghana, the agricultural sector can be decimated, and with that, we'll be sitting with a country with a very high unemployment rate, infectious disease up the roof, a supply chain that will not focus, and what is needed to support that. So we did a beautiful webinar with the Ghanaian government, and they were very keen on saying, can you help us with a plan to be prepared for something like this in terms of education levels and agricultural sector. So I'll move straight into the next one. There's some inflation rate. I'll click on the next. You'll get the slides afterwards. And the next, maybe put it in this way. In terms of the malnutrition, this is the current rates. It's estimated to go up to 70% of people under 5. Pneumonia rates would be estimated in one of our models to almost 40%, and health-related deaths to reach the triple digits if the agricultural sector is unable to yield functions at half the amount of effectivity. I'll give you another example in terms of Kenya, and then I think I've made the point over there. So we were recently in Kenya, us and the team. It's one of the fastest growing economies in East Africa. Agriculture is also a key sector in terms of Kenya in Nairobi. And same thing, very susceptible to climate change impacts. But once again, we think about what is funding and driving the economy of Kenya to provide healthcare, to provide the semblance of social health insurance, to provide their programs for the pediatrics. It's the same narrative over here. Small unemployment rate, once again, moving out to the agricultural sector in terms of this rural migration. GDP to GDP, 70% of its rural population contributing 33% of the country's overall GDP. This is completely driving the gains in the Kenyan economy. They're about the same size as us, with very low employment rate and about 33% of GDP contribution to the economy. It's very interesting. We are healthcare professionals of the information specialists. We can talk about the need to improve vaccination rates, and we get it. Decision makers in government, not so easy. You need to show them how the purse is being affected by these things both ways, in terms of the positive and the negative. 7% of its GDP because of climate change, and we're seeing massive droughts in Kenya. Just in terms of their factors, in terms of how the healthcare sector is working. Kenya has done a lot of great things, but they struggled with their maternal care. The number of under 5 deaths, neonatal deaths, injuries that occur during birth is shockingly high in terms of the regional average. And this is really showing the picture of in terms of the health risks. Now we're bringing in an equity lens. In terms of how the health sector is performing, basic output services, 90% of the facilities. But what is an output service? I see many clinicians over here going, all right, seeing a person and taking blood pressure, is that output service? How can you really see to a woman who is coming in with a birth, who's pregnant, and saying, are you hypertensive? Can we screen you for other associated factors which will increase your risk of having a high risk pregnancies? But if you look at it, it looks great. We offer services, but 2% of facilities offer comprehensive services. And that can be directly, causality, correlated to the outputs of the maternal care. 17%, a bit more than us, have some sort of health insurance in terms of that. But let's draw this up again. Agricultural sector, key to the economy. They already made gains and significant gains in their maternal and child health. But what happens if that money that was used to support those gains disappears? Basically, Kenya gets taken all the way back to the Stone Ages with high level of what we expected in the early 1990s in Africa countries with very, very high death rates about people who shouldn't be dying. In terms of the economic risks, Kenya is a very proud economy. They are building. The innovation over there is astounding in terms of both banking, in terms of mobile health, in terms of telemedicine. but they are vulnerable to food insecurity. 1.9 million, just under Ghanaians. And this is masked by the rural migration of what happens. Once again, if people can't move to the rural areas, the health of the country gets declined. I think what I'll do is, I think I'll kind of close this off over here because it's kind of repeating the same thing. Everyone over here in this room is working in the space where either in technology, using information systems effectively, or promoting education. Our call to action over here is to start thinking bigger of the ecosystem. There's been fantastic luminaries and visionaries that have spoken about how we can move back to the personal care of healthcare, personalized, telemedicine, and we need to start there. But we also have to show it from a macro perspective to say what's happening in the community, and is this community vulnerable towards any sort of change. Was just in Rwanda last week in an amazing session, and it was described as healthcare and the health risk of a person as guerrilla warfare. The person was, take any of examples, if you have a sick mom, a sick dad, a sick child at home, what does that do to your ability to work? You have immediately decreased your productivity. What happens if you have to call other people in? It's what happens in guerrilla warfare. You injure and the whole system takes a knock. So as you're looking at your information systems in your various projects, I'm asking you to look at this from balance and say, what is next? Can we use AI to start generating these risks? We know from a recent project that a 1.5 degree increase of average temperature we can predict outbreaks the next season of parasitic diseases in the equatorial region. That paper will be coming out a bit later. So there are ways that these mountains are so big that we can't see move. Can we leverage the tools we have now to start looking at these things for predictive futures? And then, when the world gets hotter, so does our tech, and we'll be able to survive. Thank you very much.